first and foremost is our centers. What we're doing is for some time now, even before this issue, we've been doing twice a day cleaning of our centers, and we've stocked up on much more cleaners, the gel, the soaps, and preparing the staff to just practice more hygiene. And so we've been doing that for some time and using hospital grade supplies to do that. So we've been doing that for quite some time. But what we are going to be doing over the weekend and before the week starts is modifying our centers a little bit to allow for more distancing space between our staff and between our clients, so that staff practice more distancing, but then our clients also are more spread out amongst each other. We're not in crowded spaces. So we want to make sure that we start the week off on the right foot to allow for our staff and our clients to have more space.
Perfect.
So I think every day we're going to get more and more information, and as of right now, we're still awaiting official guidance from the Texas Workforce Commission and from our federal funding source agencies. So we anticipate some actions to be made that allow some flexibility and quicker access to benefits. And so as soon as we have that information, we'll be able to provide it to our clients via our website, through text messaging, on our phone systems, and through the media. So we'll provide all of that outward. But we anticipate that it's going to be that the government, the federal and the state governments are trying to just get quicker access to those benefits, so there's not as big of a disruption to the jobs, to employees and job seekers. I think the best way what we can do is we are pulling in all of our resources, because we know that we as a workforce board are economic first responders. So we are pulling in all of our outreach staff that are usually out in the community visiting with employers, doing outreach type of activities. We're pulling them in, and we're going to use them as resources to answer questions from the public. We anticipate we're going to get a high call volume, so we're going to be utilizing them as backflow and overflow to answer those questions and be available to provide as much information as possible. I think that's the best that we can do, is just make sure that we answer the phone, and that we are there live and in person to speak to folks, because we know that in crises, folks tend to get, anxiety levels tend to increase a little bit. So the more that we can do to have a safe and healthy staff available to answer and provide accurate and quick information, we're going to do that.
Awesome.
I think what our advice is to both employers and workers is to follow credible sources. The city's public health department, the CDC, the World Health Organization. Follow those credible resources and follow the guidelines. Take it seriously and follow the guidelines for hygiene practices, what to do, and just stay calm and do their best. And then when it comes to actually, dealing with their workers or dealing with their jobs, be in touch with us, with also credible agencies, with the City of El Paso or with the Workforce Commission on what to do as far as their jobs, rather than getting involved and getting into the anxiety through different sources and maybe rumors. Is just to follow and keep in touch with official agencies, but then follow their guidelines as much as possible. On our website, we are constantly updating with the most accurate information as we're getting it from our federal agencies or state agencies as well, and our different partners. So we'll be updating that as we go along, and that will likely change. But we encourage folks to just stay in touch with us, either through social media or through our website or press releases that we send out to the media, and we'll just be providing information as we have it available. But we also know that folks get anxious when there is no updated information, and we'll let folks know that too, is that there's nothing changed. Stay status quo or stay on the path, just remain, stay safe, but don't change and don't pivot unless you're told to. So that's what we're doing with our staff as well. And so we're employers also, so we're something else that I'd also ask employers to do is to try to keep their employees as safe as possible. Do what they can to keep their employees healthy so that they can serve their clients. That's what we're doing as well. As economic first responders, we want to make sure that the clients are served. So we have to do what we need to do first to keep our employees safe.